and gentlemen. Welcome back to another chapter in physiology. I'm your host, Abdul Asad, and today we have an interesting subject of the female menstrual cycle. Now, this is somewhat complicated amongst medical students, but we're here to uncomplicate things. Okay, let's start with some basics. Now, the menstrual cycle basically is a cycle, so it has to have a start point and going on to an end point. Okay, so what is the first event in the menstrual cycle? Well, since it's called the menstrual cycle, so clear enough, menses or bleeding. So it starts with menses, keeps on going until it also ends with menses where the other cycle starts. Now, during the cycle, there's a very important event happening, and we all need to know this, which is ovulation. That's when the ovum leaves the ovary and waits for the sperm so it can get fertilized. Okay, on the side between before the ovulation and after ovulation, there are two phases. The first phase over here, what we call the follicular phase. Why is it called follicular phase? Because it's when the follicle, which contains the oocyte, develops. And then once the follicle bursts, it will give us the oocyte. The remnant of the follicle will give us something called the corpus luteum. So this will give us here the luteal phase. Okay. Now, all these details I don't need to know. I just need to know that the follicular phase and luteal phase. Okay. And let's talk time duration. The luteal phase takes about approximately 14 days. Okay. This is fixed. All females have a 14-day luteal phase. What about the follicular phase? Well, approximately it takes about, well, no one knows how much it takes, but somewhat in the range of 14 days. That's why you have females with a 28-day cycle. Some of them have a 30-day cycle. Some of them have a 32-day cycle. Why? Because they differ in the follicular phase. Okay, now what we said is the important part to know is ovulation. When does ovulation happen? Well, if let's say we have a female with a 30-day cycle, the 30th day will be approximately over here. Now, if we want to know when's ovulation, which is over here, what we do, we just subtract 14. So 30 minus 14 equals 16 over here. Okay, so the ovulation will happen on the 16th day. Then the female knows when the ovulation will happen, and therefore can schedule times of sexual intercourse so fertilization can happen. Since we said we have follicular phase and a luteal phase, let's talk into hormones. Now, the follicular phase has a hormone which is dominant, which is the estrogen. However, the luteal phase has progesterone. Now, what do these hormones do? Well, since we just had menses, okay, so a big chunk of the endometrium just fell off, just exited the body. So we need that chunk to grow back again. We need the endometrium of the uterus to grow back again. So estrogen will give us proliferation of cells in the endometrium. Okay, so it will make the endometrium grow bigger. Very important. However, the progesterone, what will it do? Well, what happened before progesterone? We had ovulation. So let's say we had fertilization and we want pregnancy to happen. This will go to the uterus, but it needs to have a good atmosphere, an atmosphere of an endometrium full of secretions. So progesterone will start the secretions or make the endometrium wall more secretory. So a lot of secretions will happen. In other words, it will make the endometrium more juicy. Okay, so let's just revise what we just said here. So we have the first number one thing you need to know. First event of the menstrual cycle is menses. Okay, we have two phases: follicular phase and luteal phase. The follicular phase is the phase that's variable. Okay, which phase is variable? Follicular phase. Very good to know. How do we know when's ovulation? We take the number, the days of the cycle. We just subtract 14, which is the days of the luteal phase, and that will give us the days of the cycle. Follicular phase has estrogen, which gives us proliferation of cells, and the luteal phase has progesterone, which will give us secretion, will give us a juicy endometrium. Okay, let's jump to the next slide. Now, follicular phase, first 2 weeks. Most women have it about 14 days. Or we said it's variable. Okay, we said it has estrogen, and estrogen gives us endometrial proliferation. Okay, after that we're gonna have ovulation. approximately day 14, because usually women have a 28-day cycle. That's what you'll read in books mostly. Before ovulation, we'll have something called LH surge. We'll explain that later. After that, we have luteal phase, which is 14 days. This is what we said. This is fixed. Can't change. Won't change. Okay? And in the luteal phase, the dominant hormone is progesterone. Will give us a secretory endometrium because we need a good atmosphere for pregnancy to happen. And then we're going to have menses, which will start the next cycle. Okay, here's a note we mentioned before. Total cycle length minus 14, which is the luteal phase days, will give us ovulation. Okay, so let's get into follicular phase. What's exactly going on in follicular phase? Okay, well, as you see here, we have a lot of primary follicles. Primary follicles, a lot of them over here. Okay, we want one of them to grow and give us a oocyte. Okay, we want one of them to keep on growing. See, it's growing over here, and here, and here, until it grows big enough where the oocyte bursts out. This is ovulation over here. This phase over here is ovulation. Okay, so what stimulates a follicle to grow? Well, what better thing to stimulate it than a follicular stimulating hormone? So, FSH, you remember that hormone from the pituitary? It will come in, start inducing growth. Okay, so you see here we have three follicles. Actually, we're going to have a lot of follicles, but all of them are going to die except for one. This big one is going to grow. Why does this happen and how does this happen? Nobody knows, which is good news for us. So here in the follicle, we have two main cells, granulosa cells and theca cells. Okay, these are important. Let's take a closer look about what's going on over there. But before we go there, we're going to just give you a point about after here, when you see ovulation happens, what happens to the follicle? It becomes a corpus luteum. Okay, let's put that in red because it's important. Corpus luteum. This is when the luteal phase starts, right over here in red. Okay, this is the luteal phase over here. So let's just go and let's zoom into this section so we can see what's going on. Okay, so as you see here, we have FSH, we said, we have granulosa cells, and we have theca cells, and you have here over here LH. Okay, so what's going to happen? LH and FSH are going to work together. LH will give us androgens, will stimulate the theca cells to give us androgens. And as we said in previous chapters, in the chapter of adrenal gland, the androgens are the precursor for testosterone, estrogen, and whatnot. So here theca cells will give us androgens. This will move to the granulosa cells and will give us estrogen. Okay. Now, what will estrogen do? Basically, what estrogen will give a negative feedback to FSH and LH. Okay. Negative feedback. Let's repeat again what's going on. Okay. That's just a little bit of revision before we go to the next slide. LH and FSH are going to work. LH will work on theca cells, give us androgens. Okay, androgens are gonna go to the granulosa cells, and that granulosa cells are going to turn androgens into estrogen. Why? Because it has a very important enzyme which is aromatase. Okay, aromatase will give us using this enzyme will give us estrogen. Estrogen will have a negative feedback on FSH and LH. So follicular phase. We said menses is the first day of the cycle. We said we had high FSH. Okay, high FSH will give us more estrogen secretion. That's when what we said the follicles give us estrogen. Theca cells make androgens. Granulosa cells make estrogen using which enzyme? Aromatase. Aromatase. Very important to know this enzyme. Okay. Then estrogen has what's the function of estrogen? We said before endometrium proliferation. Okay. We have secondary sexual characteristics, as you can see here. And of course, cervical mucus becomes thin and watery. Why do we need this? So sperm can swim even easier. Okay, we need sperm to swim more easier so it can go and fertilize the oocyte. So we said here that we're going to have estrogen. This is estrogen. In orange we have estrogen. In blue we have LH, and in purple we have FSH. So as you can see here, we said that FSH will first go up and stimulate estrogen to go up. But estrogen will have a negative feedback. That's why FSH is going down, as you can see here, with negative feedback. But, however, it will reach a point over here when it's high enough where you can see something's going wrong because LH and FSH are supposed to go down, but wait a second, they're going up. That's not supposed to happen. What's going on? Okay. Well, this is one of the complicated things in the menstrual cycle, which we don't know why it happens, but it happens. This is the same picture as last time. However, there's two things that changed. No longer negative feedback. Suddenly, it turned into positive feedback. How did that happen? We don't know. It's just that at a certain point, when estrogen becomes high enough in the body, it turns the negative feedback into positive feedback. So we're going to have more estrogen. So more estrogen means more FSH, more LH. That will give us more androgens and more estrogen, and it's a cycle. Keeps on going on, keeps on going on until ovulation happens. So I just want to go back a couple of slides over here. So once estrogen goes up to a certain level, as we said here, it's high enough to give us positive feedback. Okay? And it will keep on going high, keep on going high, keep on going high until it peaks. Once it peaks and begins to go down, then we have something over here in the LH, what we call the LH surge. Once we have LH surge, we have ovulation. That's a very important exam question, okay? What's the event that happens before ovulation, or what's the event that induces ovulation? LH surge, okay? However, there is a very important rule for LH surge to happen. We need the estrogen to peak and start to go down. If it doesn't peak and keeps on going up, no LH surge. No LH surge, no ovulation. Okay? So, when estrogen rises to a certain level, they begin to stimulate the secretion of LH and FSH. We have positive feedback. Negative feedback becomes positive feedback. Okay? Then we have LH surge, which will give us ovulation. Okay? It happens when estrogen peaks. So it has to start to go down because it peaked and starts to go down. If it keeps on going up, no ovulation. Okay? So LH removes the restraint upon meiosis, completion of first meiotic division, and release of the first polar body. So before, or exam question usually, when does the first meiotic division finishes? At the point of ovulation. You know, before ovulation, just before the oocyte leaves the follicle, that's when the first meiotic division happens and we release the first body. So these two things we need to you need to know because it might come in an exam question as when does the first meiotic division happen in the female menstrual cycle, or when does the first polar body gets released. Okay, so now we have the luteal phase. Okay, after the LH surge, the follicle turns into a corpus luteum, as we said last time, which will give us what's the main hormone? Progesterone, a little bit of estrogen, but mostly most important is progesterone. Okay, so we have high LH, right? Which gives us, which will stimulate the corpus luteum to function and give us progesterone. Progesterone will have a negative feedback on LH, just like estrogen had in the follicular phase, at the beginning of the follicular phase. Okay, so what will progesterone do? We said it will give us a juicy endometrium. It will give us a thick cervical mucus, and the body temperature will increase. Why the body temperature increases, I have no idea, or most likely no one has no idea. The cervical mucus becomes thick just to prevent any more sperm to come in or any kind of organisms to come in, because at this point in the luteal phase, ovulation already happened. So, as another way, sperm, you already had your chance, you lost it. Okay, so here, this is the luteal phase, as you can see, this section over here, the post ovulation, after ovulation, we have the luteal phase. Okay, now as you can see here, we have the LH is high over here. The LH is high, so it will give us the corpus luteum will start giving us progesterone, and as you said, a little bit of estrogen. It will give us a negative feedback on the LH. So now the corpus luteum will start to survive over here, as you can see here. Corpus luteum, corpus luteum. Okay, until what happens? It dies. It expires, just like milk in the fridge. Okay, it's going to expire at some point, and once it expires, no more progesterone. Progesterone will fall down. Okay, and then estrogen will fall down. So why do we need to know this? Because once progesterone and estrogen fall down, what will happen? Whole endometrium, which is big and thick and juicy, will all collapse. So, exam question. What do we need to preserve the endometrial wall, progesterone and estrogen. Why do they fall? Because we lost these hormones. We said that in the first slide, but we didn't give it much attention because I was going to explain right here. So progesterone and estrogen are the ones that maintain the endometrial wall. Once they fall down because of the corpus luteum just expired, we have menses. Once we have menses, we start another cycle, a new cycle. However, let's say fertilization happened. Okay? Let's just say we had a fertilization. First of all, where does a fertilization happen? Very important. Very important. This is a definitely exam question over here. Where does fertilization happen? This is you can guarantee it on your exam. Okay? Now, what happens if fertilization goes on? Let's just take a look. So once you have an oocyte in the fallopian tube, which is in the ampulla, waiting, it gets fertilized by sperm. Okay. Once it gets fertilized, it will start to swim to the endometrium. Okay. As you can see here, day 14 to day 15 is ovulation. Day 15, fertilization. Day 15 to 20, it will be swimming and swimming and swimming until it implants and implants in the endometrium. After that, it will, at day 25, what will it give us? It will give us a very important hormone, beta HCG. Beta HCG. What will this do? This will act like what? LH. It will act like LH. It will pretend it's LH. So what did you say LH does? It gives us high progesterone and estrogen. So once we have high progesterone, high estrogen, what are we preventing? We are preventing the endometrial wall of collapsing, basically, so that pregnancy will go on. Okay, pregnancy will keep on going on. Okay, so that's basically a fertilization. Another important point we have to mention: the second meiotic division happens in fertilization. When did we say the first one finishes? The first one finishes before right at ovulation, before the oocyte leaves the follicle. That's when the first meiotic division happens. Exam question might come in: when does the second meiotic division happen? Well, that will happen during at fertilization. Okay, oral contraceptives. This is a very important drug you need to know. Okay, so oral contraceptives, the most common are a combination of estrogen and progestins. Progestin is just a synthetic word for progesterone. Okay, so progestins, they suppress the mid-cycle LH surge. If we don't have LH surge, what we don't have? We don't have ovulation. Oral contraceptives are made so we don't have pregnancies. Okay, so if we have progestin or progesterone, this will suppress the mid-cycle LH surge. What about estrogen? Estrogen will suppress FSH. If we don't have FSH, no follicle will grow. If no follicle will grow, no oocyte. Okay, plus it helps us with some of the side effects of the progestins. Okay, now decrease effectiveness and with antimicrobial and enzyme inducers. So if some antimicrobial drugs and enzyme inducers decrease the effectiveness of oral contraceptives. There's an important part I need to explain here, which is anti-epileptic drugs. Anti-epileptic drugs. Most of them are enzyme inducers. Anti-epileptic drugs. Okay, so except now, if we have, for example, a question, 30-year-old female who's taking oral contraceptives and has epilepsy. You want to prescribe an anti-epileptic drug to her. Which drug is most applicable for this patient? The answer is valproic acid. Okay, valproic acid. It's the one that does not affect the oral contraceptives. Okay, so what are the functions of the oral contraceptives? It regulates the menstrual cycle. Okay, there you said regulates. Sometimes it's used to regulate the menstrual cycle when females have a disturbed menstrual cycle. Some of them use it for regulation of menstrual cycle. Okay, and of course it's oral contraceptive, so it prevents pregnancies. Okay, and also has a little bit of benefits: decreased risk of endometrial and ovarian cancer, and also decrease osteoporosis. Okay, but these are not as important as the most two uses or the most two functions of oral contraceptives is: one, to prevent pregnancy, and two, what? Regulate cycle. Okay. Side effects, just a little bit, just won't take much time. Okay, weight gain, high LDL. The ones you see in red is the reasons why someone might stop oral contraceptives. If it increases blood pressure, you might stop it. Deep vein thrombosis could cause clots. abnormal liver biochem, migraines, depression. These are the things that people come in and say, "Hey, doctor, I'm having one of these symptoms, and the cause might be the oral contraceptives. You might have to stop the oral contraceptives because of these symptoms." Okay, it could cause liver adenoma. The good thing about liver adenoma is that once you stop the oral contraceptives, it will go away. It will start to reduce and go away. Okay, and that's all the time I have. And thank you, everyone.